Hello, everyone. My name is Emily Bloom, and I'm head of infection control for Miami-Dade County Health Department. Today, we'll be discussing dengue. Dengue is commonly known as dengue fever or breakbone fever. It is caused by a viral infection from dengue virus, which has multiple serotypes. Dengue virus is transmitted to humans through the bite of an infected mosquito. And according to WHO, roughly half of the world's population is at risk for dengue, with an estimated 100 to 400 million cases reported each year. Patients are often asymptomatic or have mild flu-like symptoms such as severe headache, severe pain behind the eyes, and vomiting. Rarely we see severe cases of dengue that can even be lethal. These cases have presentation of severe abdominal pain, persistent vomiting, rapid breathing, bleeding from the mouth or nose, fatigue or weakness, and extreme thirst. Patients who experience these symptoms should seek immediate care. Following your dengue, you may continue to experience fatigue for weeks to come. Some risk factors of dengue include previous dengue infection, which makes you more susceptible to a severe reaction and subsequent infections. Urban living, especially in a dense population, can increase your risk. Poor area vector control of dengue viral serotypes, and climate change, with the changing climate allowing for mutation or serotypes to come to new areas. Your susceptibility of dengue is increased if you live or travel in tropical or subtropical areas. It's also increased if you spend a lot of time outdoors in these areas, either for work or other activities, as mosquitoes with dengue are often more active in the day. Your previous infection to dengue also makes you more susceptible to dengue. The incubation period for dengue is variable and depends on temperature, with incubation typically presenting 3 to 10 days after exposure, but can be even as long as 14 days after a mosquito bite. It's a 3-phase clinical presentation from febrile or fever stage, a critical stage, and then a convalescent stage with your recovery. Dengue virus does not spread from human to human, with the exception of possible transmission from a mother to her fetus. Excuse me. Rare cases of transmission via blood products, organ donation, and transfusions have been recorded, so continued care in the clinic and workspace is required. Testing for dengue can be challenging. It depends on symptom onset of the fever. 4 or greater days after fever, RT-PCR, NSI, and antibody testing via ELISA are the best methods. 7 days following fever presentation, antibody testing is the preferred method. However, there have been cases of false positives. And in those cases, we use plaque reduction neutralizing antibodies via cell culture to help resolve these false positives. The impacts on the community are pretty great for dengue, with the cases on the rise globally, and now up to 100 endemic countries with dengue. Incidence, in particular for Miami-Dade, is high due to our large Cuban residency and population, with much travel to Cuba and other areas that have seen a larger amount of dengue, especially with Cuba Ministry of Health reporting its largest dengue outbreak last summer since over 15 years ago. Prevention of dengue can be challenging. Use of window screens in our buildings, protective coverings on our bodies for clothing, mosquito repellent and coils for when we're out in the field, and vaccination for those that have had previous dengue exposure and that live and work in endemic areas, which do include the United States, with presentation in Florida, Hawaii, Texas, and Arizona, and also in the American territories. If you have any questions, please contact me at my email address here or phone. I'd be happy to discuss dengue or any other infection with you. Thank you for your time, and here are some references.